some people are dealing with addiction and trying to get abstinent. Why is it so difficult?
It's so difficult because we think of addiction as a three-legged illness. It's biochemical, it's psychosocial, and it's spiritual. Traditional treatment programs, including 12-step programs such as Alcoholics Anonymous, do a wonderful job addressing the psychosocial, spiritual aspects of addiction, but they tend to ignore the brain. Well, this disorder is driven by the brain, and it's driven by depleted brain chemicals known as neurotransmitters. The more you use an addictive drug, the less neurotransmitters you have. So you stop using, and your brain, which needs this much to feel good, only has this much. And so it starts screaming, I need something, I need something. It feels like it's starving to death. That's known as a craving. Well, it's craving because these neurotransmitters are very depleted. We can use amino acids that you can buy online or at a vitamin store to very quickly rebuild these neurotransmitter stores and reduce craving and therefore reduce relapse. Many people, after they've gone through acute withdrawal, experience something known as post-acute withdrawal, which can last for months up to a year. This is depression, anxiety, insomnia, aggressiveness. And these emotions are very uncomfortable and also lead to relapse. Well, there tends to be two causes for post-acute withdrawal. One is the depleted neurotransmitters, which we can use amino acids to fix. The other is dysregulated blood sugar. Many addicts, and we think up to 80 to 90% of alcoholics, have what's known as hypoglycemia, which is a tendency of the blood sugar to go too high if it's exposed to sugar and then drop too low. Well, as blood sugar drops too low, several things happen. One, there's not enough blood flow and glucose utilization in the prefrontal cortex. This is where we are reminded that it's not a good idea to take that next drink. It's not a good idea to go call up your heroin dealer. It's not a good idea to eat the next donut because we want to stay clean, sober, and healthy. This is also where we store our recovery skills. Go for a walk, pray, breathe, call your sponsor. Well, this part of the brain goes offline when it's not being fed adequately by healthy amounts of blood sugar. It also goes offline when adrenaline gets released. Well, as blood sugar drops too low or too quickly, the brain doesn't like this, and it says you do something, blood sugar's dropping too low, and the adrenals secrete adrenaline. Well, adrenaline also puts the prefrontal cortex offline. And so we simply don't have access to our recovery skills.